Major funding for aging matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.
Throughout the COVID-19 pandemic, older adults have been advised to stay at home to stay safe. But is that realistic for all older adults, many of whom are still working or have loved ones they're caring for and find themselves navigating the risks of day-to-day life? For those that have tried to stay safer at home, what challenges have they faced? COVID-19 has disproportionately impacted older adults, their finances, their connection to community, and their health. In Tennessee, 85% of deaths caused by COVID-19 are among adults over age 60. Nationwide, 40% of all deaths from COVID-19 have occurred in long-term care facilities. In the next half hour, we'll look at what we've learned since the beginning of the pandemic and get advice on staying safe while we wait for a vaccine. Here to share their perspective are Dr. Alex Jahangir, Chair of the Metro Nashville Coronavirus Task Force, and Dr. Stephanie McClure, an internist and geriatrician with Meharry Medical Group. Also, Carrie Brumfield, Executive Director of Senior Ride Nashville, and Rebecca Kelly, State Director of AARP. Thank you all for joining us. I want to get started with a little bit of a look back. The reality is the risks are so real for older adults, and yet a lot of folks find themselves trying to navigate life and taking on some of these risks. Is the fact that the older adults have been told to stay at home throughout all phases of the reopening here in Davidson County, is that the best solution, or do we need more of a nuanced approach?
Thank you, Will. I'll just jump in. We at AARP are concerned about people over 50, especially and their families. And I think we just start this conversation by talking about the intergenerations, multiple generations that are in many households today. And the fact that older individuals are 3 and 4 decades. We're talking about 50 and 60 and 70 and 80 and 90 somethings. And so their needs are very different, of course. But I think in general, to ask this group to stay home is, it's tough. It's hard. Some of them are still in the work world. In fact, with AARP, we have about 640,000 members in Tennessee, and 40% of those say they're still in the workforce. So the loss of job, the loss of income is significant. And many of them may have children at home, grandchildren at home. And so that presents a variety of issues.
Right. And that whole idea, I know that we sometimes think of older adults in this monolith, and it feels like that approach to, stay safer at home, it does that. Are there any consequences to the way we look at older adults, at least through the lens of the pandemic?
Yes, I would say similar to what Rebecca has shared with you, is that the older adult is not a homogeneous group. They are out working because to make ends meet, as well as working so they're not socially isolated, not necessarily because they have to, because they want to.
And frontline workers, right? I mean, folks who are actually meeting the needs of this pandemic. Older adults are in that category too.
And that's right.
But I will add this, Will, is with that said, I think over the past 9 months, our residents here in Nashville over the age of 65, I think, have taken this probably as seriously, if not more than most, right? And I think that reflects in our numbers. So in Nashville, today we have about 49,000 individuals who've tested positive for COVID since the beginning of the pandemic in March 8th to be exact. And of that, about 4,029 have been over the age of 65. So only 8.2% of the individuals who've tested positive for COVID have been in that 65 and greater age. And as a proportion of our broad spectrum here in Nashville, the population of over 65 is actually more than 8%. So I think that should tell you that people have taken this, I think, more seriously, which I appreciate. Now, the corollary to that, unfortunately, is this: if you make this, if you take the number of population over 65, make it equivalent, so per 100,000, this group is still the second lowest group to get COVID, and the first group being 0 to 17. But if you look at deaths, we've only in national, and I say only very, very carefully, 378 deaths, or about less than a percentage of people who've had COVID have died in our city. But if you look at this population of who has died, 72% of the individuals who have died of COVID have been over the age of 65. And that starts between the 65 to 74 age range, which, as you all have just mentioned, are out there in society, are working. They have about a 4% mortality rate. And then 75 to 84 is about 10%, but whenever you hit over 85, about 14% of people have died in this age range. So I guess I just wanted to show that dichotomy of these are individuals. My dad, who's 78, is still actively working. I think it's so important to continue this discussion as you guys are gearing up. But it is important to put reference of, while I believe those over 65 have done a great job being safer than most regarding this, when they do get it, this does impact people so greatly. So thanks.
Yeah, no, the stakes are really high, and in that sense, you appreciate people taking this seriously. Talk a little bit about then. Let's just have a conversation to reinforce what people can do to stay safe, whether it's staying at home, whether it's when they are going to the grocery store, or so navigating those risks and trying to minimize them as much as possible.
I think one of the greatest challenges is with families. I think somehow we think our families are safe. And I just described the multiple generations that are in families right now. And so I think looking for creative ways to stay in touch with your families. We forget that we can actually mail a letter. The children and grandchildren and great-grandchildren in many cases have refrigerator art. We used to do that, have them draw pictures. And there's nothing more wonderful than to get something like that in the mail. And then just the phone call. I think because we can't visit face-to-face, it's more important than ever that we increase the frequency of our visits for that connection.
Also keep in mind, though, that we often underestimate our older adults. I have a number of older adults in my practice that communicate with their families by Zoom, just like we are today. I FaceTime with some of my patients. In particular, I have a 95-year-old that he really enjoys participating in FaceTime with me. Being an older adult, it's never too late to learn how to use technology, and a number of my older patients do participate in video conferencing.
That's a great point. I like the idea that really this idea of safety is not an individual responsibility. It's a collaborative sort of process. And y'all maybe can speak to this, but it seems like those risks of transmission are real in home settings. That's a real place to be concerned about transmission. Talk a little bit about how can you navigate safety if we're not talking about going out, but you're talking about staying that safer at home, making sure that being at home is a safe place to begin with.
Well, I think I can maybe address that is, over 20-something, maybe 30% of case transmissions currently in Nashville are happening in people's homes. So, as I believe Ms. Kelly said, it is, I think when you're at home or you're in a familiar environment, you feel like you're safe, right? You're like, well, Uncle Joe doesn't have COVID or my grandchild doesn't have COVID. And I think the critical component here, though, is in our before we went on, you mentioned something called, which I kind of like the terminology, it's kind of like the abstinence training, right? Like we have to all be realistic how can we approach this public health intervention, just as previous public health interventions, in a way that makes sense. And humans by nature are social beings, right? We get together, especially multi-generational components. So I think a way to try to facilitate that, as Dr. McClure said and others, is critical. So highlighting the fact that people can get it at home, asymptomatic people are very much there, especially if they're younger generation. When you're in an environment, when we visit my parents, we open up the windows when we can't be outside. We get good airflow. My kids and my wife and I wear masks. we don't hug and kiss, right? Like things that we would normally love to do. So I think there is this fine balance that one can do to have important human connections, but just minimize risk right now for hopefully the next several months, right? I think for the first time in probably ever, we can all sit here and say, you know what, there may be a finish line here. We may be at mile 16 of the marathon. We still got 7+ miles to go, but there's a finish line, and we all have to just be vigilant and really be careful to do what we need to do, what we've done to this point to get there. But I do think it is important to know that it's not an all or none approach, but you have to be really smart.
Will, I would add one more thing in terms of what can we do, and that's order groceries online. What a fabulous invention. And while everybody is not able to do that, many people are. And I would just encourage those that are watching to, if you know of someone older who might need a little help in figuring out how to do online grocery delivery, then please just reach out to them and do that. If you have a parent or a grandparent that might benefit from that, either do it for them or do it with them. Because it's a huge way to sort of feel like you're still shopping and you're still part of the what we used to be able to do, and yet get some fun things. We sneak in some chocolate to my parents periodically when we order for them. So again, back to that creativity.
At Senior Ride Nashville, we've got a couple hundred of members that ride with us, and we've heard from so many of them since the pandemic started. We began making phone calls. We've since asked volunteers to kind of step in and help with that social connection. But when they call into the office, now that we've reopened, now that we're able to give rides to limited destinations again, we do hear from many of our riders telling us, this is the first time I'm leaving my house since March, but I can't put this doctor's appointment off any longer. And so folks are really taking this very seriously and just need the help from the rest of the community to step in and maintain those social connections.
Right. Dr. McClure, I mean, I know you have a lot of patients who are trying to figure out, I need to go to that doctor's appointment. How have people been keeping up with their healthcare needs during this time?
Yes, there's a number of my patients that I've been working with through telemedicine, and that's been relatively straightforward and had been an excellent process. Because they don't always need to come into the doctor's office. In fact, if they have diabetes, as long as they're able to monitor their sugars at home, and I trust that they're doing it correctly, which they normally are, all it takes is communication and guidance, and we work out a plan, and oftentimes I give them homework. And so they really enjoy that, taking that accountability and ensuring that their homework assignments are followed, and then my next visit, I follow up with those assignments. In addition, I do have other patients that do come into the office that might need to do an examination, and they've been very good about the social distancing, coming in with their mask, and they've been wonderful to work with.
That's great. Now, and I know there have been some adaptations that we've had to put in place throughout the pandemic to help make that something like telemedicine more available. Talk a little bit about some of those changes, and then now as we're looking perhaps towards that finish line, what changes do you think need to stay that we've learned through the pandemic?
Absolutely. Telemedicine's been going on for quite some time. The drawback was that for the older adult who often has Medicare was not paying for telemedicine. And now that the federal government has had the opportunity to see, hey, that this is a benefit to our older adults, I think they've now determined that telemedicine is going to be here to stay.
Talk a little bit about, I know as we've talked about older adults being at increased risk for mortality through the pandemic, and we've seen that in long-term care facilities as really a high. What do you do when we're talking about staying safe at home, and if your home is in a long-term care facility, that becomes a really challenging position to be in. What have you seen people do to address and react to that situation that we've seen?
So I'll speak a little bit about that. And before I do, I want to go back to something Dr. McClure said about telemedicine and just say that we assume that everybody has access to high-speed internet, and we still don't in this state. And so we often think, if we do, that telemedicine is the end-all be-all, and it's wonderful if you have it. But I would just encourage those that are watching to call your state legislator, if you are in an area especially that does not have access to high-speed internet, or if you know of people who are in Tennessee. We're pretty well covered, but there's still a significant part of the state in rural areas that don't have access to that. In terms of nursing homes, administrators and staff are working as hard as they can possibly work, and they're getting sick. And we are concerned about residents. We're concerned about the high death rate. We're concerned about how vulnerable they really are. There are families who have chosen to remove their loved ones from a nursing home and try to bring them home. That has its own challenges and difficulties. Homes today are not necessarily built for people that have mobility challenges. And our homes, as we've said earlier, have multiple generations. We are out and about. And so to bring someone home to that environment is not necessarily a safer environment for your loved one. So lots of things to consider. I will say this again, but the AARP.org website has a lot of information on how to maneuver and manage in these kinds of terrifically tough times.
Yeah. Carrie, talk a little bit about how you all have adapted, because, Senior Ride Nashville provides critical mobility, transportation for folks who maybe can't drive. And driving in a car is one of those things that was risky at first. How did you all sort of try to meet those needs, with the services that you have in place?
It has certainly been an evolution. In the first couple of months, we did suspend services. So we weren't giving any rides until June 30th when we resumed limited trips. But between and that downtime, what we did was begin making phone calls. We created new partnerships with organizations like the store, who provided groceries to us to deliver to our riders, Community Resource Center, who provided cleaning kits for us to get to our riders. And then we created a new program called the Friendly Neighbor Program. And that paired older adults with a volunteer who would make friendly phone calls, who would provide errand support as needed, and maybe even make an appointment or schedule some time to have a friendly distanced visit. And thankfully, the community has really come together to allow us to gradually reopen. Now we are able to take our riders anywhere they want to go within Davidson County once again. And we hope to continue to grow from where we are today. We have seen a significant decrease in volunteer engagement and ridership numbers during this time, but hoping that we'll continue to see a gradual uptick over the next 6 to 12 months.
We've all had to adapt during this period, and I think about even at MPT, we put in place some protocols for how to continue shoots and be safe, and figuring out what we can do to navigate these. And I've realized we put those protocols in place early, taking things very seriously, and now things are even, of course, more serious and more dire, and we're entering the period of winter. But we have that vaccine out on the horizon. Talk about where we are and what we really need to convey to get to that finish line safely.
So, listen, the vaccine is top of mind right now for a lot of us. For me, very much so. In England, they just started giving the vaccine to their older population first, right? And in the U.S. The recommendations will be healthcare workers, and then shortly thereafter, individuals probably over 65 and so forth. So the vaccine is hopefully going to come out in the next several weeks, actually. So healthcare workers will get it soon, and I think it's very exciting. And I think what I want to convey and what I need to convey is this vaccine, while it has come out quickly, and I think that gives a lot of people pause, especially people who've been around long enough to see many vaccines come and go. This technology is new for vaccines, but not new technology, right? So mRNA technology has been around for HIV medications and so forth. So it's actually it's gone through independent reviews and clinical trials. So I think this vaccine is very exciting. But the only way a vaccine is going to work is if people get vaccinated, right? So it has a 90+% effectiveness rate. And to put that in perspective, we're talking that's the rate of measles and mumps, right? And the varicella, chickenpox, or shingles vaccine is a little less effective than that. And the flu vaccine, just put in perspective, is about 40 to 50%. So you typically don't hear about measles and mumps anymore because people were getting vaccinated, right? And I think people need to take that away from this. If everyone gets vaccinated in our community, this COVID issue that we're dealing with will hopefully go the way of measles and mumps. Now, one more really important thing that I do want to share with people watching and who are over 65 is if you get COVID now, and you get it and it's within the first week, and you don't require oxygen, you don't require to be hospitalized, there's actually a treatment that's out now in our community that you can get. It's immunoglobulin infusions. So every hospital system now, HCA actually just confirmed this morning to me, HCA is doing it, Ascension, St. Thomas, Vanderbilt. By the default that you're over 65 years of age, you qualify for this immunoglobulin treatment, which has been shown to decrease the severity of this virus. It's been shown to keep you from being hospitalized. It's the same things that President Trump received when he was sick. So please know that there's a treatment out there. So obviously we want to do things to minimize you getting infected. But if you are infected and you are a high-risk person, so your age is older or you're younger than 65 and you have a medical comorbidity, you probably will qualify for immunoglobulin. But at the end of it all, a vaccine, which hopefully will be out within the first 3 months of next year for the group we're talking about right now, is vital. And I think talk to people, learn about it yourself. Don't believe the misinformation out there. This vaccine is really going to help us get past this. So thanks.
Yeah. And then as far as navigating the period until we can get enough of the population vaccinated, it's going to be somewhat more of the same. Talk a little bit about, realistically what life will look like until we can get there.
Well, from my perspective, it's going to be the same, right? It's going to be the same for all of us, not just our neighbors over 65. We're going to expect everyone to wear masks, keep your distance. But it doesn't mean you have to live in isolation. I think the mental health component of this is so critical that my colleagues here on this panel could probably speak to even better than me, is isolation is hard. And senior citizens typically experience isolation maybe more than a lot of our neighbors. And so we need to do the things that we need to do to be safe, and I think everyone is doing them. But know that if you do get sick, the immunoglobulin options out there, get the vaccine. But yeah, there's no magic answer beyond what I've just told you to how we get to the finish line here. So yeah, we need to continue that. But I defer to the rest of my colleagues here. They probably have better insight.
Well, and it's a great point that this pandemic is not just a health crisis, and for older adults too, this has been an economic crisis. It's been a mental health crisis. We do tend to focus on the physical health aspect of this, but it is so much broader than that. Talk about those in the last few minutes we have, like keeping track of the broad needs that folks have, for complete well-being.
I think we need to remember that we're all in this together. That reminded me of my own mother, who lives in a rural area here in Tennessee, and she doesn't have internet. And the way that, of course, we communicate is telephone, but it's very important that neighbors look out for neighbors, family. Remember to look out for your family members and other relatives that may not be getting those phone calls or check-ins. So it's a matter of us all looking after each other.
I think, you can go knock on a neighbor's door to start a conversation if you're not comfortable doing that or you don't know how to make a connection. Call 211, call any nonprofit in your community. Every nonprofit that I know of that is serving older adults right now has pivoted and created new ways to keep people connected. And that includes people like me who are under the age of 65 who also wants to stay connected.
And I would just add, we know there's a greater dependency now than ever on the use of drugs and alcohol to try to just combat the struggles of it all. And I think being aware of that and just doing what you need. If there's a long-term addiction, then certainly stay in touch with your groups that are meeting virtually now, I understand. If it's a shorter term, then the things like exercise and eating right and making sure that you're moving and doing the things that we know are just good, healthy habits. It's so easy to curl up on the couch with a blanket at times like this, and that's not at all what we need to be doing. So, taking advantage of Carrie's friendly neighbor program. AARP has a community connections program, and as she said, reach out if you're that individual, and if you're not and you're concerned about somebody, don't let them go too long without connecting with them.
That's great. Well, we're here at the end of our conversation. We've run out of time. I want to thank all of our panelists for participating, and thank you for watching. I hope this conversation has helped you prepare for the road ahead as we all strive to get through the COVID-19 pandemic. To learn more and see all of the programs in NPT's Aging Matters series, visit our website, wnpt.org/Aging Matters. Thanks for watching, and stay safe.
Major funding for Aging Matters is provided by the West End Home Foundation, enriching the lives of older adults through grant-making, advocacy, and community collaboration. The Jeanette Travis Foundation, dedicated to improving the health and well-being of the Middle Tennessee community. The HCA Healthcare Foundation, on behalf of TriStar Health. Cigna, together all the way. Additional funding provided by Jackson National Life Insurance Company, the Community Foundation of Middle Tennessee, and by members of NPT. Thank you.